how dangerous is this mix of summer heat waves and coronavirus? Well, with me to discuss more is Parham Azimi. He's a postdoctoral fellow at Harvard University's T.H. Chan School of Public Health. Thank you for joining me.
Thank you for having me.
Now, we've had to get used to a lot of changes during this pandemic, economically, socially and stress-wise, that have also strained local resources that would usually be there to support people. Now add to that this above-average heat. How bad is the situation in America this year, and what does the heat mean for vulnerable populations?
Yeah, so we all know that we are facing a tough situation in the United States. It's not limited to the United States, and it's a worldwide crisis. But unfortunately, United States is among the countries that they are suffering from the second wave of COVID spreading. And heat wave can might make it the situation more complicated and might make it even worse.
And so for the areas that are experiencing a second wave of COVID-19 and now these heat advisories, especially in the south and southwest of the U.S., how might we see this playing out if things do get worse? We have to be careful about how we are reacting to a heat wave. So heat wave would cause people to stay indoors more, and in this situation we have to be sure that our indoor environments are safe enough. So we know that there are more data that COVID can transmit through the air. So in this situation, our indoor environment should have enough ventilation, should have enough filtration or air disinfection to reduce the transmission risk. And are we seeing any overlap or correlation between those who are most vulnerable to heat-related illnesses and those who are most at risk for COVID-19?
Yes, unfortunately, older people above 60, they are more vulnerable to COVID and heat, both of them. And for example, if you think about a senior housing, so older people in those housing or nursing home, they, because of the heat, they have to make most of their activities indoor. And what would make it worse if the facilities doesn't provide enough ventilation or filtration or air disinfection for the people. Just cleaning surfaces is not enough. We have to be careful about the airborne transmission of COVID, which is a real risk here.
So what are some suggestions you have when it comes to the precautions people can take for those who do suffer from both heat and COVID-19 risks?
I think what they have to do, they have to make their buildings safe. If they are living in a multi-family building, they have to become sure that the air is not shared with the different units. If it is shared, they have to be sure that the HVAC system is using 100% outdoor air to supply 100% outdoor air. If it is not possible, at least put a great or high efficient air filter inside their HVAC systems. In a more critical situation like hospitals or shelters, they can install upper room GUV systems, UVGI systems to reduce the risk inside homes. So they have to be sure that their buildings are safe enough.
Now, for some of these modifications, obviously they cost money, and this is coming at a time of record unemployment, a lot of rents also being missed. What should people be aware of when it comes to the economic impact that comes with some of these heat-related issues, especially at this time of uncertainty?
I'm not my expertise is not economics, but I can tell you that some of these interventions that you can put in your homes, they are not very expensive. And actually, it is shown that some of these interventions are less costly than, for example, cleaning the surfaces or disinfecting surfaces in offices building. So yes, they are costly. They might add extra money, but they are affordable. So putting an air purifier inside your room that you are staying, if there are other infected people inside, so it would make you safer. It is affordable. So most of these measurements are affordable.
All right, thank you so much. Parham Azimi there, postdoctoral fellow at Harvard University's T.H. Chan School of Public Health.